Welcome to the Nevis Newscast for Thursday, March 14th, 2019. I'm Donis Wilkinson Keynes. Members of government institutions, businesses, and faith-based organizations today, Thursday, March 14th, participated in the Carib Wave Tsunami exercise, which was facilitated by the Nevis Disaster Management Department. The scenario was a tsunami generated by an 8.5 magnitude earthquake located on the northern Panama deformed belt.
I decided to participate because it is important to know what to do and how to do what you're asked to do whenever a situation like this occurs. Now I got a call sometime after 10 o'clock, and of course my office is right there at the Social Security building. Indeed, we were informed on previous occasions as to where some of the safe zones are, and this was the closest point to my office, which is Zone 1 Auto. This simulated activity is one that is supposed to mimic what an actual serious situation would be like or should be like in the event there is a tsunami that impacts the island of Nevis at any point in time. Well, I am happy to have participated. There are quite a number of persons here with us who I met on my way as I was traveling towards the safe zone. And of course, once we got there, we were met by personnel who were here and recorded the name and the offices of the persons who would have had to run to this particular point.
Minister of Disaster Management, the Honorable Alexis Jeffers, added that the exercise would have met its objective, noting that persons have been sensitized on how to respond in the event of a tsunami. Among the entities participating in the tsunami exercise were the staff and the students of the St. Thomas's Primary School and the Ines Fans Preschool, who proceeded to their safe zone, the Keith Arthurton Playfield in Jessops.
Our students were quite prepared and ready for the drill as they executed what they had to do before, during, and after a tsunami. Our children are quite knowledgeable and know what to do as it pertains to it. We heard our cue and we heard our alarm went off, and our children were quick in response, including our teachers and auxiliary staff. And we can safely say that all of our children, along with the Ines France Preschool, made it safe to our safe ground, and we hope that in case of real tsunami that our children are able to execute what they have learned today and even in the past, so that we are safe at the end of the day.
Londa Brown is the education officer responsible for the St. Thomas's Primary School.
At the department, we realized that there were a few of our schools who are in the danger zone, and so it's a priority for us to ensure that the procedures that are in place for those types of situations are in check. And so I was here today just as an observer to see what the school plan is and to see if there are any kinks in the plan, to see if we need to make any edits to the plan before an actual event happens. By the time I got here, there were a couple of students who were already here. So they obviously knew what to do, they knew where they were going, and they knew what to do when they get here. So they were here. There were about maybe 8 students who were already here and registering their name with the volunteers who were at this site. And we waited on the others while they came. When they came, they got themselves together in classes, and the teachers were able to keep track of all the students.
Carib Wave is the annual tsunami exercise of the Intergovernmental Oceanographic Commission of UNESCO. Today, Junior Minister of Health, the Honorable Hazel Brandy Williams, toured the Alexandria Hospital to give an update on the hospital expansion project, as well as the commission a new ultrasound machine.
It is a proud moment for us as an administration, and more so from the Ministry of Health perspective.
The Junior Minister of Health expressed her gratitude to the team on behalf of the Senior Minister of Health, the Honorable Mark Brantley.
This machine has come at a timely venture when we would have experienced some difficulties doing our ultrasounds. I am indeed very happy that the technician would have explained that this bit of equipment is forward-looking. It can do most of the tests that we are doing now, and it has capabilities for future tests that would come on stream. By merely submitting or attaching some new software, we'll be able to do more advanced tests in the future. It means then that we At Alexandra, we are remaining current and we are even forward-looking, more forward-looking than ever before. I want to place on record that this is a major investment done or placed by our administration in terms of improving the services here at Alexandra. And so on behalf of the Senior Minister of Health and Premier, I would like to say thank you very much.
Richard Suter, representative of Philips International, spoke about the functions of the machine.
The Affinity 50 is a high-end Philips, very advanced system. This system is capable of doing 3D, 4D for being able to see babies and abdominal structures in a 3D and 4D method, giving the doctor in the hospital much better information on the patient, as well as capabilities for doing urology, obstetrics, radiology, and vascular work. And the machine is also capable for cardiac as well. So it's a well-apportioned system, which we hope is very beneficial to the people of Nevis.
According to Hospital Administrator Gary Pemberton, last year the ultrasound machine was out of service for a few days, hence the reason for the purchase of the second machine. Also present at the brief ceremony were Acting Permanent Secretary in the Ministry of Health, Shalissa Martin Clark, and radiologists Glenford Herbert, Karima David, and Walman Yedra. Still to come.
Although kidney disease has numerous complex causes, research has shown that hypertension and diabetes are the most common.
We'll give you the details after this break.
The Ministry and Department of Agriculture presents Open Day 2019. It's Silver Jubilee, 25 years of feeding the nation, on March 28th and 29th, 9 a.m. daily. Venue, the E.T. Willett Park. Under the theme, Think Climate Smart, Food and Nutrition Security and Sustainability.
Welcome back. Today, Thursday, March 14th, Nevis is joining the observance of World Kidney Day by promoting the theme, Kidney Health for Everyone. Junior Minister of Health, the Honorable Hazel Brandy Williams, says this year's theme calls for universal coverage for the prevention, diagnosis, and early treatment of kidney disease.
Although kidney disease has numerous complex causes, research has shown that hypertension and diabetes are the most common. Hypertensive and diabetic patients with kidney failure present higher morbidity and mortality rates than those with normal kidney function. The prevalence of chronic kidney disease is expected to increase not only as a result of the rise in life expectancy, but also as a result of the high prevalence of obesity, hypertension, and diabetes in the general population. To date, Nevis's public health centers have on record 473 diabetic and 522 hypertensive patients, and those figures are expected to increase. Chronic kidney diseases are not curable and can trigger a myriad of other health problems such as heart attacks and strokes, which may lead to premature death or lifelong disabilities.
The health minister notes that the best hope for reducing the human and the socio-economic costs associated with the epidemic lies in prevention.
The Ministry of Health will continue to 1. Implement community health education programs aimed at encouraging persons to adopt healthier lifestyles. 2. Make screening for kidney diseases a primary healthcare intervention. 3. Ensure chronic kidney disease patients have access to and receive the basic health services they need to improve their quality of life. And 4. Encourage a multi-sectorial approach to non-communicable disease prevention by engaging our partners in the Ministries of Education, Agriculture, sports, and non-governmental organizations such as the Nevis Renal Society, we continue our partnership with the government of the Republic of China, Taiwan, in the Chronic Kidney Disease Project.
Minister Brandy Williams also highlights that the World Health Organization and World Health Assembly targets to reduce non-communicable diseases include a 30% reduction in population salt intake by 2025.
Salt reduction is important for reducing hypertension, the risk of cardiovascular accidents, and chronic kidney disease. I take this opportunity to invite the general public to join us in our Salt Awareness Week, which covers the period 10th to 15th March 2019, under the theme, Reduce Your Salt, Protect Your Kidneys, Pinch, Don't Pour.
The Honorable Hazel Brandy Williams making an address to mark the observance of World Kidney Day. And finally, Nevis Electricity Company Limited NEVLEC customers are advised of a scheduled power outage from 9:30 a.m. to noon on Friday, March 15th to facilitate the upgrade of lines at Hard Times, Gingerland. Areas to be affected are Taylor's Pasture to Liebird Hill and areas in close proximity. Customers are advised to take every precaution to safeguard electrical equipment at all times of interruption and restoration to the electrical supply. NEVLEC apologizes for the inconvenience that may be caused by the outage and remind customers that in each case, service may be delayed to later than the time specified. For additional information, call NEVLEC's customer service at 469-7243, 469-7245, or 662-5799, or its emergency service at 469-9100 or 662-5811. That's how we end this edition of the Nevis Newscast. On behalf of all of us here at the Department of Information, thank you for viewing.